Hi everyone, and welcome to the 52nd episode of Vitals and Voices. I'm Lepika and I'm the founder and host.
I'm Ava, and I'm the Guest Relations and Outreach Manager.
And Vitals and Voices bring together generations of people involved in healthcare in order to foster a supportive and connected community.
Please welcome our guest, Dr. Pirkle.
Thanks so much for having me. Y'all can call me Sean.
Of course. Thank you so much for joining us today. We're really excited to have you on Vitals and Voices. To start us off, feel free to kind of introduce yourself and share a little bit about what you do.
Perfect. Well, I'm really happy to be here meeting everyone. I'm tuning in virtually from Seattle, Washington. I'm currently an orthopedic surgery chief resident out here at the University of Washington. I'm planning on applying into two fellowships currently next summer, starting a foot and ankle fellowship, and currently applying into pediatrics orthopedics with ultimately the goal is to take care of kids, limb length differences, do guided growth, complex foot and ankle deformity, things like that.
Really love that. So turning into our first question, what first inspired you to pursue a career in healthcare, and how did your early experiences shape your path into medicine?
Yeah, I think I first realized I wanted to go into medicine when I was a senior in high school. That summer, I spent a lot of time with my couple of my cousins and my uncle and his family down in Honduras. They were living there at the time, doing a lot of medical mission work. And the goal of my summer was really just to go down there and like learn how to speak better Spanish. I was taking a lot of Spanish classes at the time, but I ended up spending a lot of time at the hospital and the and one of the schools in the community. One of the days though, I remember we ventured out into the community, and one thing led to another, but I remember a boy had fallen and hurt himself pretty bad. And kind of in all of the excitement, a team of doctors had surrounded this boy in his home to tend to him and provide care. And I remember standing like on the outside of the circle as a senior in high school, like really wanting to be able to do something. And in that moment, the reality of the situation for me is that I really had nothing to offer him, and I felt really helpless. And I think it was that sense of like helplessness during a time in which somebody needed something that really kickstarted my medical journey. So I looked to these doctors being able to provide this care, and I was very inspired. And I went home after the summer and decided I wanted to go into medicine, be a doctor. I think that really kickstarted everything there.
It's really cool. I feel like that's a very powerful journey, and I can see how those connect and made you want to go into medicine. And you've spoken about being especially drawn to patient stories. Can you share how some of those moments influence your understanding of what it means to care for someone?
Yeah, medicine is such an interesting career. It's such an interesting job where we meet people uh, of all walks of life who have had something that has happened to them, and you're meeting them on perhaps like the worst day of their lives. And we expect them in that moment to be able to make really hard choices about how they want to be cared for, choice that will affect them potentially for the rest of their lives. And I think as important as it is as a doctor to be able to understand their pathology or the pathophysiology of what brings them in, it's almost more important to understand who they are as a person in order to provide them the best recommendations. I see people every single day who've had like really bad injuries happen to them on the orthopedic surgery side. Um, and I can have a patient with the exact same injury, the exact same fracture pattern, but based on their story, their maybe functional baseline, their comorbidities, their experiences in the healthcare field, the risk that they are willing to take, I might provide two entirely different recommendations for the exact same injury. And I think that's where the story can provide a lot of insight into the care that they will get and is the care that is like the best for them, the most individualized plan for them.
Yeah, I definitely agree. So, during your medical training, what led you to gravitate toward orthopedics specifically?
Yeah, ortho is pretty self-specialized. Um, the first decision I feel like I really had to make into what within medicine I needed or I wanted to get into was early on in medical school. And that first branching point is typically deciding between medicine and surgery. Those two like umbrellas are very, I would say, different in terms of what how they treat people. Medicine is more, I would say, like very thoughtful, methodical, titrating medication, slowly changing things over time. It has a big focus on preventative medicine, whereas surgery is very like I would say hands-on, and you see a problem and you fix it. You're staring at it. You reanastomose, bowel. You can take out a diseased section. You can put the bone back together and plate it, put plates and screws on it. And for me, I was more excited about that. I could see something and fix it in a way that really only surgery can. I would say orthopedic surgery is like the far extreme of that, where you can make tangible change. If somebody breaks their arm, you put it back together and then they get back and it heals and they do their life. And that was like infinitely, like selfishly very satisfying for me. And something that I could see myself doing for the rest of my life and enjoy that satisfaction. And then, sort of along a similar timeline of when I was making this decision about pursuing surgery itself, I was actually diagnosed with Crohn's disease. And for those of y'all who, might not have as much background, it's like an inflammatory autoimmune condition that affects your bowels. It can cause like small bowel obstructions and abdominal pain. And uh, these days, there's some pretty good medication out there, but the treatment typically is medical. You take a medication, you take it for the rest of your life. It suppresses your, alters the way your immune system works such that your body doesn't keep like attacking the bowels essentially. And being a patient with this condition, it was really honestly frustrating for me to know that my only treatment is something that I'm going to have to take like a medicine for the rest of my life. And it is working really well. And I'm like endlessly thankful for that. But at the same time, it's very frustrating. And I think for my career, I've chosen something that is so far away from the condition that I have. I guess sort of out of like I don't know, maybe defiance, but at the same time, I think it just is more satisfying to do for me personally to do surgery. So I would say overarching, like the big things that you can accomplish with surgery, plus my own personal experience with chronic illness is kind of everything that like shepherded me toward a career in surgery and orthopedic surgery specifically.
I like how you mentioned the differences between medicine and surgery. That makes a lot of sense how it's like instant results versus overtime because you do notice that.
Yeah,
Um,
and I'd say both are extremely powerful. It's not just that surgery helps people, like medicine, you can do like so much good even on the medical side too.
that's very true. For your next question, orthopedic surgery can be very physically and emotionally demanding. What motivates you to keep doing this work even on the hardest days?
Yeah, it is really hard. It's a lot of training too. I end up going, it's 4 years undergrad, 4 years of med school. The ortho residency's 5 years. I'm doing two fellowships on top of that. So it is really demanding the training. And I agree with what you're saying, like the physical part. Our days are hard. We're in lead. We're putting like, large bones, muscles back together. It can be really hard. I think in the midst of all of this, I think something that I reflect on actually quite a lot these days is like what my 18-year-old self would think. And I know if I could go back to that person who was standing like in that room looking at doctors caring for a little kid, and I could tell them now, you're sitting here as a chief orthopedic surgery resident taking care of all these people every single day. Like this is my dream job. And I'm so thankful and grateful for everything that has brought me to this moment, that it's hard to not have that perspective. Even on the hard days, I can look back and say, this is what I've been training for my basically entire adult life, and I made it here. And like I would have killed to be in this position. So I just feel like infinitely like grateful. And I think that's also where um, like the mentorship comes into play. Like I really, if I can like help other people see that, like that, I think that is just infinitely like important.
Yeah, I definitely agree. I think remembering your why and why you wanted to pursue medicine definitely motivates you on some of your hardest days. So you mentioned enjoying many aspects of your job, from teaching to helping patients feel more comfortable. What moments in your work feel the most meaningful to you, especially?
Yeah, that's a good question. I think my gut would say it just like surgery itself is so satisfying when a case goes really well and you can like, see like all the training kind of come together in a case. But honestly, I think my the real answer for me is these like little experiences that you have with patients. My specific area of interest is going to be hopefully pediatric foot and ankle, lower extremity deformity. And one of the most challenging parts of pediatrics is that you oftentimes are communicating with a family. It's not the patient itself or themselves. And that like trust aspect of the doctor-patient relationship is infinitely more like more weighty. Like, and all that to say, like I know there's not like I would say an aha moment of each patient interaction or like a family interaction, but there are these little moments during every time I chat with a family where I can see that I'm gaining their trust and trust to the point where they're going to allow me to take care of their kid. And that might mean not doing surgery, but it also might mean doing an invasive procedure on somebody and like building up a family member's trust is, I feel like, such a privilege to be able to take care of their kid. That those are like the things that I would say keeps me going and makes it so exciting to see all this training that I've had for the past few years, culminating with a family, parents allowing me to take care of their kid.
That's so true. I could see how that could be fulfilling too once you do gain their trust and they start to kind of confide in you and stuff. And wellness has been a major focus for you throughout your medical journey. Why do you think wellness is such an important issue in medicine?
Yeah, I joined the wellness committee in medical school. I went to the University of Chicago in Hyde Park, and we have a wellness committee there that has a couple of representatives from each of the class. And the whole goal of the committee is to make the process of medical education more enjoyable and really get at the heart of what is it that leads to what we do know are higher rates of burnout, higher rates of like depression, suicide amongst physicians, prescription drug addiction, alcoholism. We are really good at taking care of other people, but as a medical community, as a profession, we're not that good at taking care of ourselves. And the whole point of the wellness committee at U Chicago was to try to like make that experience more enjoyable. What is it that we can do that will make us, better, more sustainable as a profession? So I did that for 4 years, and that was, I would say, a large part of who I was in medical school, and I've carried that with me through residency. I write a lot of op-eds there's online blogs, through my own personal writing, with the goal of trying to make that process better, more equitable. Um, the whole theme, I would say, for my, wellness journey is trying to make the process better for other people. It's like leaving the path behind me easier for somebody else to traverse. Um, I would say that is like what continues to help inspire me to work in the wellness realm.
Yeah, I definitely have to agree with you. Again, I think burnout is something that can happen to many of us. And, being in the healthcare profession field, it can happen twice as much. So definitely wellness is such a major important issue. So you mentioned that you've advocated for wellness through writing and committee work. How do you hope those efforts help improve the culture of medical training?
I hope it helps keep pushing us in the right direction. I think it's really easy uh, to look back on all the progress that we've made as a field and be complacent. Because medicine has, I would say, fundamentally changed from the field it was when my attendings were training and what I'm going through now. And I would say it's changed in a positive way. It has gotten like way better, but there's still so much room for improvement. One of the themes that I continue to hear echoed is that we've come to a point where people start to it becomes like a sacrifice of the educational opportunities to continue to push for progress. And I would push against that notion where I think there's still so much room for improvement in the field. And if I, through my writing, can help continue to make the field better, that is certainly a goal that I have in mind. Um, I've had some people saying back in my day, we had it like much harder, and you guys should just be thankful for how far we've come. But I think that continuous like tragedy of progress is that you may never get to experience the good for which you're fighting for. And I think you should continue to try to keep doing that, such that somebody coming behind you will have a better, more enjoyable experience of medical education, which is really hard in itself.
I totally agree. I feel like I always hear people say that, like, oh, back in my day it was harder or whatever, but people have always said that, so it's like
Exactly, yeah.
there's always going to be that issue, I guess. But yeah, continuing to push through, even though people might think you have it easier, definitely makes
Mhm.
sense. And writing has been an important outlet for you alongside clinical work. How has writing helped you process the human side of medicine?
I started writing more frequently once I started medical school. I didn't really enjoy it or think or thought I enjoyed it until I would say my senior year in college. I was applying to med school, sent like 20 some odd apps to all these programs, and the way the process works is they send you back a secondary application. Most schools do these days. And each secondary application has like 2 to 3 essays that you have to write. And it can be on like wide-ranging topics, difficult patient experiences you've had, writing about failure, whatnot. And I would sit there in my apartment. I was doing a research fellowship that summer. So I'd go to work, come home, go to the like lock myself in the basement and just start tackling all these essays. And I spent like dozens of hours just like thinking about the choices I'd made in my life and trying to extract meaning from these seemingly insignificant decisions and experiences that I've had. And I really enjoyed that process, that slow thinking, that reflection. And I took that with me to medical school, where I ended up writing about, I would say, everything that was happening around me. The whole goal was to write, I did have a goal of writing a book, but I wanted it to be an expository essay. This is what medical school is like. This is the board exams. These are clerkship rotations. And it was going to be kind of a how-to guide. But as more things were happening, like to me and around me, the book really took on a new life, and it became a book about life just through the lens of medicine. And I would say writing has allowed me to process all of these experiences, made me more reflective. It's made me more thoughtful. It's made me a more compassionate person. So I think that together is what I take from writing, what that has been able to offer for me.
Truly love that. So, congratulations on publishing your debut book, Somewhere in Between. And that book explores everything from burnout to meaning in life. So, could you tell us what inspired you to kind of write it, and what do you hope that readers take away from it?
I think a lot of the initial urge to write the book came out honestly from a place of fear. I was starting medical school having had no idea really what I got myself into. My parents are in medicine. I was sitting there in my parents' apartment in Atlanta, Georgia, like a few weeks before everything started, and I was really scared. Um, and I wanted to basically, sort of touching on our previous conversation, write a book that would make the path easier for people coming behind me. That could be that expository piece that can guide them, hold somebody's hand through the process, or give somebody an understanding of what it is that they're getting themselves into. So that was the initial urge to write the book. And I think it still accomplishes all of those initial goals, but it has been able to talk about so much more. You mentioned some of the themes it talks about, but for sure, like burnout, dealing with chronic illness, going through a global, pandemic, finding love, finding meaning in life. It goes through all of these things that just so happened to be happening while I was becoming a doctor. Um, I hope like ultimately, I do hope. I think you asked uh, what I hope readers take away, and I hope that they understand that they can and should be able to see themselves in medicine, even if it feels like medicine is such a foreign field. or you don't have family members in it, or you don't really know what you're getting yourself into, I hope everybody can read the book and understand that they can see themselves in it.
I love that. And it's good to remember too that there's like so many different areas of medicine. So even if somebody doesn't think they can go into surgery, maybe they'll go into a different field. So that's good to remember. And to wrap things up, what advice would you give to students or trainees who are navigating the pressures of medicine while trying to protect their wellness and sense of purpose?
It's so easy to keep looking forward. This field kind of requires it in some sense, where there's always a new application. You kind of know what you're getting yourself into in some sense, in that your life is dedicated to like 4 year chunks. You're going to be in college, you're going to be in med school, you're then going to do residency for 3 to 5 years, then it's fellowship, then you get to be an attending. And with all of that, every step, it's so easy to keep looking forward at the next step. I just can't wait to be in college. Once I'm in college, if I could just get accepted to med school, like everything's gonna be perfect. Then you're a med student, you're like, I just want to get into residency. And I don't know where it stops. And it is really hard. I would say it's easier said than done, but I would just encourage everyone to try to take a moment and like try to be present, because the journey is like your life. The experience that you're going through is the experience of your life. And it's so easy to want more, the next best thing. But really, I would say try to look around and enjoy where you're at every step of the way. I have a reminder in my home like every day. I wrote a sticky note like years ago, and it just says grace on it, to give myself grace, to understand that what we're going through is really hard. And it's so easy to like want the next best thing. But I just use that as a reminder to try to really be present, to give myself grace and like self-empathy, to be going through all these really hard moments and try to find support in that way.
That is really good. That's very powerful because I feel like our world is very rushed at times. So it's good to remind yourself to kind of slow down and take advantage of like what's going on in your life. Thank you so much for sharing your journey and for offering such thoughtful insight into the technical and human sides of medicine today. We really appreciate you being here.
Your
Well, thank you so
story
much for
was,
having me.
of course, your story was such a powerful reminder that caring for patient also means that caring for ourselves and each other within the medical community.
To everyone tuning in, thank you so much for joining us on this episode of Vitals and Voices. Your continued support means the world to us.
If you enjoyed this conversation, then be sure to follow, share, stay tuned for more episodes of Battles and Voices.
We'll see you next time.